Now 7:23, and this month, February, is American Heart Month. Heart disease, the leading cause of death in the U.S., killing more than 600,000 men and women. And Dr. Scott Simeon with People's Health joins us now with more. And thanks so much for being here.
Thanks for having me.
And we were just talking, you're a primary care doctor.
Right.
You treat people and try to prevent them from having to go to the cardiologist and sometimes it's too late or things are already happening.
Well, you know, one of the focuses I have about heart disease is to try to prevent something that is somewhat preventable. I mean, we don't want to wait till we're having crushing chest pain and head to the ER and then we find out, oh, well, you've got 3 blockages in your heart and that type of thing. But, you know, heart disease is a very serious matter, as you just said. You know, it's responsible for about 600,000 or more deaths in the U.S. every year. And so we want to make sure we prevent heart disease before it ever really becomes a major problem. You know, we encourage everybody to get to their doctor and just get some routine blood tests, cholesterol, check your blood pressure, these types of things. I see far too many patients who come in and see me after not seeing a doctor for 10 years or more, you know, and then they come in and their blood pressure's been high, and sometimes the damage is already done. So the important thing to remember is just to try to prevent these things from happening and start early, because everybody will develop some degree of heart disease or cholesterol buildup in their arteries. So the important thing is to make sure you eat healthy, exercise. I can't emphasize the importance of exercise enough, just some sort of regular exercise every week, every month, every day.
And obviously, if heart disease runs in your family, you know you've got a family history,
right.
Those people should go see. But if you don't have any history, at what age should you start going to a doctor to get all those checkups, the things you mentioned, like the cholesterol?
Well, I mean, you know, usually it's recommended that even in your 30s you should start getting checkups, maybe not every year, but really certainly when you hit 40 and definitely 50 and older, you want to get annual checkups, annual blood work for these types of things. But the important thing, again, to note is just the things you can do. Eating healthy, don't smoke. Smoking is just really one of the worst things you can do to your body, and people always think about the effects it has on your lungs or possibly, you know, association with lung cancer and chronic lung disease. But many people don't even put an association between smoking and heart disease. But I can guarantee you, if you smoke, you will have some degree of heart disease and cardiovascular disease.
And what does the smoking do to the body? How does it cause the heart disease?
In many ways, some of the chemicals that are in cigarettes make the arteries a little more, I like to tell patients that makes it a little more sticky for cholesterol, makes it more, the lining of the arteries inside makes it more fragile, more brittle, that type of thing. But it's
so the blood flow, it's not an easy flow through the body?
Right. Well, I mean, what causes, when we think of heart disease, I mean, there's a lot of different types of heart conditions, but heart disease that I'm referring to really is more the coronary heart disease, or coronary artery disease. Keep in mind, the heart is an organ itself, and it itself needs a blood supply and oxygen and nutrients, and the coronary arteries surround the heart, and when those arteries get blocked, what we think of as coronary heart disease, and that's what we're talking about today. So again, you know, smoking, obesity, all these things are risk factors. Healthy or eating unhealthy. So obviously, the things you want to do to prevent heart disease or prevent serious heart disease are to do all those things that you know, to try to stop all that. Don't smoke, eat healthy, exercise. Those are the 3 biggies.
Now is the time to start if you haven't started already.
That's right.
February Heart Health Awareness Month. Thank you so much, Dr. Scott Simeon, for joining us.